If someone told you that you have a bad breath, should you take that personally? We're not talking about you went out to have lunch that has a lot of garlic and onion in it and then you stink. We're talking about chronic bad breath, halitosis. It's a complex issue and we need to find out where is the problem is coming from.
So what's the effects of dental implants on bad breath? Before we answer this important question, let's look into most common causes of bad breath and how we can differentiate between one bad smell and the other, and how each one of the smell can contribute to a different diagnosis. If we pull out studies that was published on PubMed from reputed dental journals and some opinions from the Mayo Clinic and the Cleveland Clinic, we can conclude that bad breath is 90% caused by oral disease, such as gum disease, dental infection, dry mouth, different tongue anatomy, poor oral hygiene, that's very important, and other causes such as respiratory infection, GERD, uncontrolled diabetes. Now, there's a lot of contributions to fasting and some liver and kidney disease. And let's keep in mind that not all oral bad breath smell the same, and each different smell can actually lead us to a diagnosis of where that smell is coming from. Let me explain a little bit. So if you have the sweet or the fruity smell, it usually tells us that you have unmanaged diabetes or you have a low-carb diet, for example. The nail polish smell or the acetone smell, that's usually uncontrolled diabetes. If you have that rotten garbage smell like, it usually indicates that you have oral infection, respiratory disease, poor oral hygiene. The sulfur smell is caused by the normal mouth bacteria feeding and breaking down food debris between the teeth and most noticeably on the top back of your tongue. That's how you get that very distinctive sulfur smell. The sour smell, it usually indicates that you have GERD or gastroesophageal reflux disease. The feces smell or poop smell usually is intestinal in origin, and it can be an indicator for bloating or constipation. The ammonia smell can tell us that you have kidney disease. The musty smell can tell us you have liver disease. Dental implants can have an influence on your mouth breath positively or negatively. The positives come from having implants to replace missing teeth, give you enough biting surface so you can eat better food, improve your diet, and also eliminate a lot of spaces between the teeth so you don't have food that get caught in between. On the other hand, they can negatively affect your breath smell by getting infected. Implants get infected just like natural teeth. They also can have gum disease. The prostheses that get fabricated on them can be done negatively, so you actually have more space between the implants and the gum and get more food debris cut in between. One important factor is that a lot of prostheses are made out of acrylic. We don't like doing this. We like to keep acrylic as a material for removable denture, not for fixed prostheses. By having the acrylic material inside the mouth, it gets rough and attracts bacteria and food debris. So these are the most important factors.
If you're getting value out of this video, please like and subscribe so we can reach out to more people like you.